Legal considerations. The school nurse, when available, is the most appropriate person in the school setting to provide care for a student with diabetes. However, many schools do not have full-time nurses. Even for schools that do, the nurse may not always be available at all times during the school day, during school-sponsored extracurricular activities, or field trips to assist with routine care and emergency care. Trained school personnel must be available to perform and assist the student with diabetes care tasks. This presentation is not intended to provide legal or healthcare advice. Please consult with a legal or healthcare professional regarding your specific questions or needs. This training component was created specifically for school nurses and other qualified healthcare professionals to train non-medical school personnel. This unit is Legal Considerations. This unit will be on laws that impact diabetes care in the school setting and will include federal laws that protect students with diabetes, impact of state laws upon diabetes care in the school setting, recommendations for 504 plans and IEPs. Students with diabetes need a medically safe environment. Students with diabetes must have the same access to educational and school-sponsored opportunities as do students without diabetes. Safe and supported transition to independent diabetes self-management is important. 3 federal laws address the school's responsibilities to ensure access for students with disabilities. Section 504 of the Rehabilitation Act of 1973, the Americans with Disabilities Act, or ADA, and the Individuals with Disabilities Education Act, or IDEAs. The purpose of this training is not to fully describe these laws, but rather to talk generally about how they might impact care provided for a student with diabetes. This slide provides an overview of the framework for planning and implementing accommodations for students with disabilities under 504, Americans with Disabilities Act, and IDEA. One or more of these laws applies to all schools except a private religious school that doesn't receive any federal funding. These laws provide for related aids and services designed to meet the individual needs of the student, free, appropriate public education, equal opportunity. Section 504 and ADA prohibit discrimination against children with disabilities by schools and/or daycare centers. IDEA also requires special education for students whose diabetes or other disability adversely affects education performance. For example, this might be the case for a student who often experiences high and low blood glucose levels at school or who has to miss a lot of school because of diabetes-related complications. It is important to make sure that the school personnel, parents and guardians, and the students agree on how the Diabetes Medical Management Plan, or DMMP, will be implemented and what accommodations and related aids and services may be needed for the student. This information is included in Section 504 Plan, Individualized Education Programs, or other education plans. The information in the DMMP can be used in developing either a Section 504 plan or an IEP, but is not a substitute for Section 504 plan or the IEP. The Individualized Healthcare Plan is developed by the school nurse to implement the DMMP. The IHP communicates the nursing management strategies for the student in the school setting. A 504 plan is the term commonly used for the written plan developed under Section 504 of the Rehabilitation Act. An individualized education program is required for students who receive special education and related services under the Individuals with Disabilities Education Act. The emergency care plans are quick references developed by the school nurse that describes the individual student's symptoms and treatment of hypoglycemia and hyperglycemia. The 504 or IEP plan should address accommodations needed for both routine and non-routine school activities and settings, even for relatively infrequent events like standardized testing or overnight field trips. Listed on the slide are examples of the types of things that might be addressed. Anticipating such events and proactively addressing them when the plan is written will not only ensure the student's safety and full participation, but also help to avoid misunderstandings and potential conflict between the school, the parent guardian, and/or the healthcare provider. A sample 504 plan can be accessed on the American Diabetes Association website. State and local laws and regulations vary regarding who may perform various aspects of diabetes care. Some states allow non-medical school staff members to provide routine and emergency diabetes care. Some states have laws that require a minimum number of school staff members to be trained and available on site to provide diabetes care. Some states limit the ability of non-medical personnel to provide care. Become familiar with state and local laws that specifically address school diabetes care. Regardless of state and local law, the requirements of federal laws must be met. Thus, diabetes care cannot be denied based on a state or local laws or policies that seek to limit who can provide care. For more information about your state's laws, go to www.diabetes.org/fedlaws.